Today we're going to be going over the basic functions of an operations manager at a clinic. And I kind of want to take this from a patient perspective because that might be something that we're used to. Oftentimes in a clinic you think of in the medical setting, well, what are the business side and operations that happen at a medical clinic? So let's take it from a patient perspective. You go to the building, you are there because there's an appointment that is set up for you to see a provider or a physician at that time, at a certain time. And so you're there and you know that the provider is going to come in, they're going to basically check up on whatever you're there for, and they put you on a certain schedule. So you need to come at a set time. And they perform what's called a visit. And this is them seeing you. And then after they see you, they chart on it. And so they'll do some documentation. And then oftentimes after the visit, they will send you out to go to see someone else, or if they're a specialist, send their notes back to your primary care. So we can call these like referrals or communication. Or communication. All right. And that's just not the first person that you see at the clinic, though. When you initially go to the clinic for the first time, you're going to see someone in the front. And the person at the front desk is probably the person that helped you schedule your appointment. And so they look at all that stuff, as well as taking in your insurance and updating any information that they might have on you. And so these are often the people that you see when you first come in. You know, they greet you, they look at the provider schedule and all that stuff. And then there's usually someone who is a medical assistant, and that is this person right here. And they usually are the ones that, once you're brought to your room, maybe they bring you to your room, your exam room, and they take your blood pressure. They do something called an intake, right? They ask you how you're doing, the standard questions, medical history, updated meds, all those stuff. And they do basic things like maybe, like I said earlier, take your blood pressure. They might sometimes administer like vaccine, or do some of the basic stuff, prep the room. And get everything ready for the provider to see you. Oftentimes they probably bring this chart right here, which has all your patient information, and they usually bring that to the provider, which is up here. So, these two people usually talk to each other. Anyway, all of this back-end stuff that happens is managed by someone, and that person is the ops manager. Now, the ops manager has the role of working specifically with the physician to make sure that these teams right here are doing what they're supposed to. Or not what they're supposed to, but that can best help the physician. So they're more of like the support team that helps support the physician and make sure that all the operational challenges over here, we'll split these in two sections. We'll say that these are more of the operation stuff, and the physician does more of the medical stuff. We'll put that here. Medical stuff, the stuff that actually has to do with your health and what you came initially for here in the visit. The medical assistant also helps with some of that stuff, but they're also there for logistical purposes so that the physician can see as many patients as they want. So the ops manager is in charge of things like updating the staff to know which insurance we take, what the schedules are for these physicians, as well as the schedules for work. So work schedules. They also deal with things like patient complaints. So let's say that someone at this patient complaints. Let's say someone at this level right here says that they came in today, maybe they were late from like a car accident because of something that happened due to traffic. So they talk to their front desk person, which throws the schedule off of the provider because they were supposed to come in at 8:15. They actually come in at, let's say, 9:30, and the provider or physician already has people booked during that time. So the front desk can then talk to the ops manager to see if there are any deals that they have with the provider, or if the physician's okay with putting them in on certain schedules, or like what the whole policy is regarding that, or if there's any additional information they may need, or let's say an MA is usually assigned to one provider at a time, or one specialty, depending if it's multi-specialty. And let's say this medical assistant called out sick today. That is something that the ops manager would have to deal with. That way, the physician can work on making sure that the patient is seen or taken care of as they were initially asked to in the visit. And that is mainly the basic functions of an operation manager at a clinic from a patient perspective.